Thank you very much. So may I begin my poster presentation?
Yes, please, absolutely.
Thank you. Again, very good morning, good afternoon, and good evening to all participants. My name is Dr. Wong Foong. I'm from IMU University in Malaysia. Today, I'll bring everyone through on a very preliminary kind of study, and that is in regards to improving the quality of life for a hypertensive crisis patient using both Chinese medicine and Western medicine approach. And that's what we meant by the integrative case studies here. Some background information for everyone to understand. Hypertension is actually a global-wide issue affecting lots of people. In Malaysia's context, it affects around 32.9% of the Malaysian population. And as Malaysian population ages, we anticipate that there may be an increase in terms of people getting this hypertension issue, as it is actually one of the non-communicable disease that is in the high list of the Ministry of Health Malaysia. Usually, patient who has hypertension, they would actually require to be on antihypertensive drugs. And once they started taking it, it will have to be a long-term thing. So compliance is an issue. And on top of that, the reason why it needs to be taken long-term is because not only that it is needed to control the blood pressure, but more importantly, it is needed to prevent any complications as a result of the hypertension. So complications that are commonly seen include stroke, myocardial infarction, and heart failure. Based on literature review from China and mainly from China and some other Asian countries, Chinese medicine has been found to actually pretty effective in addressing mild hypertension cases. And there are a bunch of research publications that have been seen. However, in terms of the effect of Chinese medicine, whether or not it can address a hypertensive crisis case, it has not been well documented so far. So the purpose of this study is to evaluate whether Chinese medicine is effective enough in addressing hypertensive crisis case. The methodology that we use for this preliminary study is that we have a retrospective study looking back into the case records that we have at our IMU University Chinese Medicine Center. So a hypertensive crisis female patient, age 58, has been recruited based on this retrospective study. The duration that we look into is between May to November 2023, so that was last year, and we retrospectively look into the treatment provided in terms of both Chinese medicine and Western medicine, and then we review the results. So the kind of criteria that we use to evaluate the effectiveness include obviously the blood pressure levels. So that is used to confirm whether or not the treatment is actually effective. On top of that, we would also want to look into the quality of life of the hypertensive crisis patient. So any accompanying symptoms, for example, like neck pain, dizziness, and blurred vision, which were previously reported by the patient, we would like to observe whether or not these symptoms have continuously appeared throughout the treatment period. And that will be used to evaluate the quality of life. So based on the data that we have available, we can see from table 1 here that there's a timeline listed here. So the patient actually came to the IMU Chinese Medicine Clinic around end of May 2023. And that time, patient already started to have the hypertensive crisis situation. As shown in the table 1, the blood pressure has shot as high as 220 over 100 milliliter mercury. Patient at the time was only on atenolol 50 milligrams, And she had constantly suffered from neck pain, dizziness, and blurred vision, along with the high blood pressure. So upon seeing this, we realized that this situation could not be simply just treated by Chinese herbs or any other Chinese medicine methods, simply because it would not be fast enough to quickly bring down the blood pressure and therefore control any complications as a result of this high elevated pressure. So we advised the patient and sent the patient to see a Western medicine doctor. But unfortunately, because of the taboo that most patients in Malaysia would have realized, as in, when you're on an antihypertensive drug, you're forever on it. They have this impression. So it actually took a while for the patient to finally decide, after constant persuasion, of course, that, the patient should seek advice from a cardio specialist. So the patient finally went to see the cardio specialist in June, and the cardio specialist not only increased or bump up the atenolol, double the dose, so it now becomes 100 milligrams. But on top of that, another drug, which is amlodipine, has also been given, and it's 5 milligrams. So after this combination of treatment using both beta blocker and calcium channel blocker, which is these two are actually like the first line of defense that we would use, at least in Malaysia, for treating hypertension, the blood pressure has been brought down. So we can see that the blood pressure could be reaching as low as 102/60, but on occasion, and it's actually quite frequent, that the blood pressure is not very steady. It will shoot back as high as 159/70. Patient, on top of that, also constantly still having neck pain, but dizziness and blurred vision, not so much anymore. In fact, blurred vision, according to the patient, has actually drastically reduced to the extent that she did not actually feel it so much in terms of affecting her life, day-to-day activities. However, as noted, the accompanying symptoms actually still sort of affected her, especially the neck pain and dizziness, resulting in her unable to sleep well, and her daily motion has also been affected. So after looking into that, and we monitor for a period of time, so that we confirm that the blood pressure pills given by the Western medicine has actually started its full effect. But in July, we still realized that it's not doing its good job in controlling the blood pressure. The pressure is still pretty much fluctuating. That's why in August, we decided that no, we should intervene it further with Chinese medicine. So on top of the atenolol and amlodipine, we have prescribed modified TMR Golden Tang, a Chinese medicine herbal formula commonly used to treat hypertension, to the patient. And after prescribing these to be used together with the Western drugs, for a period of time, we then started to see the blood pressure has further lowered. So the low point can reach as low as 100/60. But the high point, it's just 127/70. And this range, even though it's actually much lower, but it actually also suggested that the blood pressure range could be retained, or at least maintained as close as possible to a normal, healthy human being. Not only that, the most important thing is that the accompanying symptoms of neck pain, dizziness, including blurred vision as well, no longer be seen. So it's like totally disappeared. And this has started to appear in August, and it just seemed to continue until October as well. And in October, after close monitoring for such a few months, we realized that, yeah, the antihypertensive drug could further be lowered. And that's why we asked the patient to go back to see the family doctor. And the family doctor then suggested that, yeah, the antihypertensive drug could be further lowered, especially the atenolol. So with that, we then further monitor the blood pressure as well as the accompanying symptoms. and it is still the same, as in the blood pressure still maintained more or less within the normal human being range, and there is no accompanying symptoms appeared. So the results actually further confirm that the combination used of Chinese medicine and Western medicine drug together can actually bring some benefit to the patient. So the conclusion from this one single case is that integrating Chinese medicine and Western medicine could actually have the potential to help restoring blood pressure to a much stable level, as close as possible to a normal healthy human being. And not only that, it can actually prevent hypertension-related complications, as well as improving compliance to the medication. Not only just hypertension complications, but any other adverse effects as a result of long-term use of beta blockers, and as well as calcium channel blockers could also be mitigated as a result of that. So therefore, the patient's quality of life can be improved. We noted that this is just a preliminary studies, so therefore one single case may be just a coincidence. So therefore, the limitation is that this is just one single case. So for future studies, we would like to suggest that perhaps a prospective study could be included, and further large-scale studies, for example, like a clinical trial, could also be conducted just to confirm that this is generally applicable to all other patients. And there is my references. Thank you very much.
Great presentation. I can see a question from something you can see. What would be your first line drug, and what is your step-up drugs? And so would then ACE inhibitors be your first line drug? Have you checked drug-drug interactions? Are there any?
Yeah, to answer these questions, first of all, I'm from a Chinese medicine background, and in Malaysia context, as Chinese medicine practitioner, we are not allowed to prescribe any Western drugs. And that's the reason why when the patient sort of like reach into the stage where the blood pressure is stable, we have to refer the patient back to family doctors or the cardio specialist so that the Western medicine doctor could make the adjustment for the patient. So therefore, in terms of first line of drugs, yes, aside from beta blocker, calcium channel blocker, yes, ACE inhibitor is also being used, but we would not be able to prescribe that as a Chinese medicine practitioner. In terms of drug-drug interactions, yes, we have checked before, and the ingredients from the Tianma Gouteng has no direct interactions with the beta blocker and amlodipine. I hope that answered the first questions.
I believe it does. It did. So next question that I see from Dr. George Grant, that is a great presentation. Herbal medicine is needed to control BP. What about lifestyle factors in preventing and reversing the BP?
Yes, this is a very good question. In this case, we are focusing on whether or not the Western medicine, when it is being used together with Chinese medicine, could actually help the patient. There are, and surely there are other factors at play as well. But because this is a retrospective studies, we will not be able to dig into such lifestyle factors and make it well under control. And that is another of our limitation. And that's why future studies should probably also want to look into these.
Interesting. So how about, so many allopathists do not accept herbal medicines. The reason that they use steroids, is this true?
Short answer is no. We don't put steroid into our Chinese medicine. This is actually written specifically in the Malaysia law. It is banned. So therefore, no steroid is mixed together with Chinese medicine. However, we have to also understand that there are natural occurring plant steroid, but those plant steroid will not be as strong as the Western drug steroid that we have seen. So it doesn't actually affect in terms of thinking like the plant steroid would have the same effect as in the Western drug steroid.
Interesting. So, you know, it mentions about allopaths, things that it is that in herbal steroids being used. Right, that's the question.
Yeah, I suppose this is the same question, right?
Yeah, it's the same question continued, but how far this is true?
No, not at least in Malaysia context. Most allopathic practitioner in Malaysia thought that the reason why they are skeptical about Chinese medicine is because they could not find much information, at least like research publication and things like this, that they could understand. Probably this is due to the reason that most of the publications are not available in English. It's available in Chinese and some other languages, for example, like German. There are lots of publications in German, and yes, some in Japanese as well. And probably that's the reason. So it's not so much about steroids, but it's just that no access to it. And there are quite a few papers that have mentioned about these. So to improve on this interprofessional learning thing, one of the things that we have to do is to bridge this gap by sharing knowledge with other healthcare practitioners.